Okay, now we're going to talk about sprains when we talk about different types of injuries. Sprains are injuries to ligaments which surround all synovial joints in the body. The severity of sprains is highly variable depending on the forces involved. Sprains can be classified in one of the following three categories: first degree sprain, second degree sprain, third degree sprain. Shouldn't really hard to remember that it's first, second, and third degree. Let's talk about first degree sprains. First degree sprains are the most mild form of sprain. Only mild disability occurs. These sprains demonstrate little or no swelling and are associated with minor ligament damage. These are the ones we tape up and send back out on the field. They usually can go, even though they hurt a little bit. Second degree sprains. Second degree sprains are the more severe. They imply more actual damage to the ligaments involved, with an increase in the amount of pain and dysfunction. Swelling is more pronounced and abnormal motion is present. Such injuries have a tendency to recur, especially if the athlete does not complete rehab. So people who continuously have ankle sprains over and over probably have not done any kind of rehab to stabilize their ankle and to see that they don't happen again. Right here you have a picture of a second degree sprain. You see how there's a lot of swelling in here. There's some swelling down in the foot, and you get this purple color. We call this ecchymosis. Whenever you were wondering what that term was when you're looking at a picture, that is ecchymosis. That's that purple discoloration they start getting when the sprain starts to heal. Third degree sprains. Third degree sprains are the most severe type of sprain and imply a complete tear of the ligaments involved. Given the extensive damage, pain, swelling, and hemorrhage will be significant and are associated with considerable loss of joint stability. As you can see here, there's a lot more swelling, a lot more discoloration. This person probably does have a third degree sprain right here. Not only because of the swelling, but because of the severity of the injury and how purple it's looking, and even right off the start, you see this purple here. That is ecchymosis, but it looks like it's a rapid onset purple, which kind of signals that there's something more severe going on with the ankle sprain. But you see, you still get some of that ecchymosis coloring right back here around the bottom of the foot. Now we're going to talk about strains. Strains are injuries to muscles, tendons, or the junction between the two, commonly known as the musculotendinous junction, or MTJ. The most common location of a strain is at the MTJ. However, the exact reason for this is unknown. We don't know why they happen at the junction between the muscle and the tendon. As the case with sprains, there is tremendous variability in the classification in the severity of the sprain. They are classified within one of three categories: first degree, second degree strain, third degree strain. First degree strains. First degree strains are the most mild form with little associated damage to the muscle and tendon structures. Pain is most noticeable during the use. There may be mild swelling and muscle spasm present. So these aren't quite as severe. Sometimes they can go back and play with these kind of injuries with the first degree strain. Second degree strains. Second degree strains imply more extensive damage to the soft tissue structures involved. Pain and swelling and muscle spasm are more pronounced, and functional loss is moderate. These type of injuries are associated with excessive force stretching or a failure in the synergistic action in a muscle group, meaning that the muscles don't fire right when they say synergistic, causing a strained muscle. Third degree strains. Third degree strains are the most severe form and imply a complete rupture of the soft tissue structure involved. Damage may occur in a variety of different locations, including the bony attachment of the tendon, avulsion fracture, the tissues between the muscle and tendon, the musculotendinous joint, or in the muscle itself. So these can happen anywhere. And when I say avulsion fracture, what happens is, in that kind of a strain, it pulls a piece of bone attachment with the muscle away, causing that avulsion. A defect may be apparent through the skin and will be associated with significant swelling. Obviously, this type of injury involves significant loss of function. So you may see the muscle kind of roll up, or you may see an indentation in the muscle with this kind of a strain because it tears several muscle fibers. Right here, this person has a 3rd-degree strain of the Achilles tendon. You see how much swelling they have here as compared to this one right here. Here's a trick on how to classify them different: sprains and strains. Kind of like your Taco Bell sauce. You have mild for 1st degree, hot for 2nd degree, fire being worst case scenario for 3rd degree. It's a good way to remember it.